Good evening, everyone. My name is Dr. Pooja, and my topic is the impact of part-time occlusion therapy on fine motor skills in unilateral moderate amblyopes patient. It's not working. As we know, reduced stereopsis is the most common visual deficit associated with amblyopia, which results in poor fine motor performances. Fine motor skills in amblyopic children are observed to be suboptimal as compared to children of normal age group. As visual acuity and stereo acuity is reported to improve significantly after amblyopia therapy, fine motor skills are also expected to improve. The aim and primary objective of the study is to evaluate the impact of part-time occlusion therapy on fine motor skills in children aged 3 to 10 years with unilateral moderate amblyopia at 4 months as compared to baseline, which is measured by Bender Visual Motor Gestalt Test. And other secondary objectives are to explore the changes in the performances of the study participants following motor tasks as compared to the baseline after 4 months of the part-time occlusion therapy. These fine motor skills are developmental coordination disorder questionnaire, Ray-Ostrich complex figure test, Jepson-Taylor hand function test, and Bender visual motor gestalt test. Other secondary objectives are to determine any possible association between different types of amblyopia and improvement in fine motor skills. Baseline visual acuity and improvement in fine motor skills, types of refractive error and improvement in fine motor skills. It is an hospital-based prospective interventional study conducted between April 23 to April 24. The sample size was 35, and the patient was patient visiting to ophthalmology and pediatric OPD of AIMS Rishikesh. The inclusion criteria are consenting patient, age range of 3 to 10 years, children with moderate amblyopia with no history of previous treatment for amblyopia, compliant to best refractive correction for at least last 12 weeks, and patient should be orthophoric. Exclusion criteria are mild and severe amblyopia, any coexisting macular, retinal, or corneal disease reducing visual acuity, significant cognitive impairment, history of any brain or neurological disorders, craniofacial abnormalities, history of any blunt trauma, penetrating trauma to the eye, history of any prior intraocular surgery except the cataract surgery, myopia with a spherical equivalent of -6 diopter, and known skin reaction to patch or bandage adhesives. This is a schematic diagram showing the study flow. First, written informed consent was taken, then relative history taking was done. Basic ophthalmological evaluation, including best corrective visual acuity, refraction, intraocular pressure, anterior segment, and fundus examination was done. Along with baseline binocular test, stereopsis was conducted with baseline fine motor skills. Assessment was done. Then 2 hours of part-time occlusion therapy with 1 hour of near work was prescribed to the patient. And assessment of all these fine motor skills, including stereopsis and binocular function test, was done at first and 4th month of the follow-up. These results were used for our study and analysis. This is the Bender visual motor gestalt test. This consists of 9 index cards, and the score ranging was 0 to 13 were given to the subjects, while higher score indicates the poor performances. This is the Ray-Ostrich complex figure test. The participants were asked to copy this figure, and the score ranging was 0 to 36 was given, while lower score indicates the poor performances. Jepson-Taylor hand function test. The patients were given 7 items, which include writing, turning the cards, picking up small common objects, simulated feeding, stacking checkers, picking up large light objects, and picking up large heavy objects. The results were measured by time taken to accomplish each task. More the time taken as compared to age match control indicate poor performances. This is the DCDQ developmental coordination disorder questionnaire. This questionnaire is developed for parents, as parents know their child the best and can reliably report developmental problems. This consisted of 15 items, which are grouped into 3 distinct factors, which includes control during movement, fine motor and handwriting, and general coordination. These are the results showing the improvement in vision at 2nd month and 4th month of the therapy. This is the Rando test in Titmus stereo acuity test showing the improvement after the therapy. And similarly, Worth dot and Vagolini striated glasses test showing the improvement after the therapy. These are all fine motor, these bar diagrams showing the fine motor skills improvement after the 4 month of the therapy. These are the significant improvement we found after the therapy. So we found significant improvement in fine motor skills at 4 months of the amblyopia therapy, and we also found anisometric amblyopes demonstrated significantly better improvement in BCVA at 4 months, and Ray-Ostrich complex figure at the 2nd and 4 months of the therapy. There was no significant association observed between fine motor skills and etiology of amblyopia. To conclude, a positive impact of amblyopia therapy in the form of 2 hours of part-time occlusion therapy with 1 hour of near visual exercises on best corrected visual acuity, stereopsis, and fine motor skills was found. Reduced stereo acuity has been shown to have correlations with poor performances in fine motor skills as compared to reduced visual acuity alone. Thank you.
Where is the hand area situated in the brain?
Frontal lobe.
Frontal lobe where? The whole area is frontal lobe. But there is a reason I am asking you this question. Where is the hand area situated in the brain?
Area number 4, sir.
Huh?
Area number 4.
No. It's situated close to the frontal eye field area. It's 1 millimeter below and anterior to the frontal eye field area. Now, stimulating the frontal eye field area can stimulate the hand area. Patching, how does it stimulate the frontal eye field area?
Sir, patching improves the vision and stereopsis.
No. How does the patching stimulate the hand area? It doesn't do anything.
See, we all know that amblyopia therapy, better stereo acuity helps in motor skills, fine motor skills. This is all, this is all there.
Next is
So,
Ankita. Ready?
What does your study tell us?
Sir, my studies tells that if vision improves with part-time occlusion therapy and stereo acuity also improves, so fine motor skills should also improve.
They would improve because stereo acuity has improved. If I close one of my eyes, my fine motor skills are not going to get good. This is all there. So I think you should publish it. See, that is how people publish. When you read articles, you feel that there is nothing new in this. So you better publish it like this, that whether these questionnaires can replace stereo acuity, and then it is something new that you have come up with. Right now you are talking about stereopsis has improved, and these fine motor skills, this is known. Whether these fine motor skills improvement can also mimic an improvement of stereo acuity, and so you don't need to check stereo acuity, rather you check fine motor skills.
Okay, sir.
So you can do it. I don't know whether they will publish it or not, but this is another way of looking at it. Good, very good.
Why you have chosen 3 hours of patching? The age range was different.
Yes, ma'am.
Yeah.
But the recent studies have shown that part-time occlusion is equivalent to full-time occlusion
that
therapy.
I know, but 3 hours were
2 hours, ma'am. 2 hours. These are my patients are moderate amblyopes, so I have chosen 2 hours of part-time occlusion therapy.
okay.
Thank you.